The event was our first co-design event in Torbay, and we were co-designing future services, speaking with people with lived experience with diabetes, rheumatology, respiratory and neurology conditions. And some of the consultants and MDT were here to hear what service users, patients were saying about services and what thoughts they had on what could be done better and what ideas they had to make improvements.
I suppose in many respects what today was about is actually reconnecting the NHS and other services actually back with the patient. 10 years ago we used to really engage with our patients and decide and actually work with them to develop services, and I think that's been lost. What this event did was put different specialties together in the same room to see how we can actually start to tailor services around the patients. We can't keep doing the same old thing again and again and again and again. It's not going to make the services tailored to what patients need.
I think it's just really exciting for being quite ill for such a long time and thinking that it was going to be like this forever, still having to battle all the time. So having something like this, there's a place that there's hope still, and maybe it will get better, and you're given a voice, and I think that's so essential because with health you have all the control taken away from you. So doing things like this, you feel like you're listened to, and it's exciting.
What I would like to see coming out of today is this is one of the first early steps in really accepting that it isn't like organisations delivering to sort of passive recipients. I think what I'd like to see today is that we sort of jointly designing services, and we're involving the whole community. I'd like to see us breaking out of silos. And I think that is one of the dangers that we've thought about, health in one place, social care in one place, community in another place. And I think we are starting to sort of to merge those, to break out of silos and look at whole community responses. And I think there are real challenges to health and social care in the future and to communities. And I think we have to bear that in mind, that we can all start working together to a sort of common agenda. But that agenda needs to be jointly set between patients and providers.
Just having people in the room having those proper conversations about what's good, what's bad, can we actually stop doing that? Or actual fact, I found that really useful, or I didn't know that was available, was really important. And I certainly know of one patient in the room that's actually turned the whole thing round, where he was the patient and had his doctor helping him with his condition, and when the doctor got the condition, the patient was helping the doctor. So it's really important that people can have those safe conversations and we can develop the services based on that.
So I think this event is interesting. It's a first look at trying to co-design the future service, which is what we're really all working towards, trying to make our outpatients work for everyone in the 21st century. I think this should give us some really interesting ideas about how we might start to change things or look at models that we could test out. For me, I'm going to be really interested to see how this all sort of pans out in Devon, because I want to take it back and take this work on in Dorset. So it's going to be interesting to see how it goes.
Being able for a change to put the patient's point of view instead of just accepting that you have to do what you're told to do because that's the way things are in hospital. And I found that speaking with people in different stages of having rheumatoid arthritis today, alongside staff that helped to run it, was very enlightening.
I really hope that the people that use our services feel that we want to listen, and that not only we will listen, we will take their suggestions forward and they will be put into action, so they'll see the difference that their suggestions have made.
The things that have been suggested today some of them have been very simple things that could be done easily. And I've got hopes that these things will be achieved and that it'll move forward and that there'll be more seminars in which people can voice their thoughts again.
I found the day to be inspiring. I think there's a deep philosophy behind this, which I haven't really seen before. And that philosophy is co-design, co-delivery, and really looking at the needs of the individual and the needs of communities. And I don't think they're divisible. I think they all come together. And I think what I found today is that we were going to where people are, rather than where we would actually like them to be. So I was quite enthused by the entire day. So I'd really like to thank the agencies involved for coming together on this.
I think this type of event is really valuable for everyone. It's been really valuable for me as a member of staff, but also I think valuable to the patients. And there have been several people who said to me already this morning that they really enjoyed themselves and really benefited from listening to all of the discussion and participating in it. So hopefully there'll be more of them.
I found the day really very interesting so far. It's been a great mix of different types of patients, different conditions. I'm a rheumatologist, so there's been rheumatology patients here, but also patients with diabetes, other long-term conditions, and also looking at patients who are at different stages along their pathway, so patients that are very engaged with their care and patients that are less engaged with their care, and seeing how those different groups respond to the sorts of questions we've been asking. It's been fascinating.
Today's been really interesting, actually. I didn't know what to expect, but it's been fun hearing about everybody's different views and quite enlightening, actually realising some people have got the same views as me, and actually maybe things I have problems with, why they are the way they are. So yeah, it's been really interesting.
Everybody's ill, and what we're trying to do, those of us that have the illnesses, is to get people to understand that we've got something to give as well.
I'm hoping that we'll be able to act on some of the ideas that have come out, the ones that are feasible, and we'll do our best to bring them to fruition.
We've got to take this away and really make it happen. Clearly, one clinician was only due to come for a morning and she stayed there all day. And it's important that, she's seen that there's some quick wins that they can really do to make a difference to patients. But I think some of this is going to take a bit of time to build up and work up. And at that point, we need to bring those patients back into the room and make sure that what we're trying is actually going to work for not just them, but the wider cohort of patients that we're working with and offering services to. So I think there's some great learning. It's now down to us to actually do that really hard job of not only making it work, but sustaining it and making it work.